Hello everyone. Today the topic of our discussion is bow legs. Bow legs is a common condition in children. Many times the parents they bring the child to the OPD and their major complaint is that हमारे बच्चे की टांगे टेढ़ी हैं. So what is actually bow legs? So bow legs is a condition in which one of the both of the child's legs they curved outward at the knees, which causes a wider space than normal between the knees. It's called bow legs because shaped like bow. There's धनुष की तरह हो जाती है. So what are the causes of the bow legs? One of the most important causes of the bow legs is physiologic bow legs. It's a part of the normal development of the child because of the space constraint. When the child grows in the mother's womb, there is space constraint. It causes some bones to twist in a way, cause bowing. The second cause in our part of the world is rickets. Rickets is a deficiency of calcium and vitamin D. Deficiency of these calcium and vitamin D, it causes the bones to become softer and weaker, which causes the bowing. Third important cause is if the child has sustained any injury or any infection around the knee, which causes the growth plate damage and it causes the bowing. Fourth important cause is Blount disease. It's mostly seen in the African and American children. Most of them are the overweight and they started to walk early. And in some cases, if the parents start putting the child in the walker at the early age, and it may also cause bowing. What are the signs and symptoms of the bow legs? Most important sign of the bow legs is the appearance of the child leg. When the child is standing with his feet and ankle together, there is space between the knees. The bowing is mostly obvious during the walking. Bowing doesn't cause any pain. Bowing doesn't affect your child's ability to crawl, walk, or run. Some of these children they walk with their toes pointed inward, the pigeon toe or the in toeing, which gradually corrects itself. So next is how to diagnose the bow legs. It can be done by the examination, by measuring the distance between the inner aspect of both the knees. Second is by doing the X-rays to detect if there's any calcium or the vitamin D deficiency, that is rickets is there. And third thing is by the blood test, the calcium, phosphate, vitamin D test to assess if there is any deficiency of these. Treatment of the bow legs. In case of physiological bow legs, no treatment is required generally. Most of these cases they correct by itself by the age of 2 years. If bowing doesn't correct by the age of 2 years, then some treatment is required. In case of bowing due to rickets, supplementation with calcium and vitamin D usually corrects the bowing. Bow leg sprints are used to correct the bowing, which the child has to wear mostly at night. It gradually corrects the bowing by delaying the growth on the one side. And lastly, in some cases, surgery is also done.